Well, hi, everybody. I'm Lisa Gargis, and Josh Lawford is with us today. He is in his car, so he will be in and out. He's traveling today. But what we are here today to do is just simply, with it being the first day of AEP, we know you're all really busy, but we wanted to just be here today to answer any questions that you've got. If it's about AEP, if it's about plans, if it's just whatever questions that you've got, we want to be here today to answer those questions. So we don't have a PowerPoint, we don't have anything, any agenda. Towards the last half of the call, Robin Brooks is going to join us from Blue Cross. So she, is the guru of Blue Cross. So if you got any Blue Cross questions, she will be here to help us answer any of those as well. But that's all today is going to be about, because we know a lot of you, this may be your first AEP. You may be a little nervous about that, may have some questions that you just want to ask some of us that have been around for a while. And so that's what we're here for. So jump in and start. You can unmute yourselves and just start asking away. So we hope you've got some. I've had some people email me some questions that we're going to bring up, but I'm going to let you just unmute and start asking what you would like to.
I have a
Anybody?
question.
Yeah.
Are the new rates out yet?
As far as the deductibles and that type thing?
The actual premium?
Let me see if this is what you're asking about. These type things?
Okay. All right. I got you.
Is that what you're asking, Bruce?
Yes, to a degree. Yes.
Okay. So, for those of you who have been to our office, I'm sure you have seen this chalkboard. We have this chalkboard in every office here at Alabama Health Guidance. This is what we work off of. So every year, as you know, these numbers change. And so they have posted these numbers. If you Google them, this is what they are. This is the new deductible for Part A. This is the cost of Part B, and then the deductible for Part B. And so we have just redone our chalkboards. And then I always have Angela print this up for me, because of course not everybody has an office that they work from. So we have this so that if you want to print it out and use it, if you go into an appointment, then we have this and I can email it to you if you would like it. But these are those new numbers for 2026. So if you don't have those yet, then we thought this might be very helpful for you today. So the deductible for Part A, now if someone just has Medicare and they go into the hospital, it's $1,716 deductible. Now, if they have Part B, they're going to pay $206.50 a month. That went up from $185. Okay. And then their deductible for Part B is $288. Now, a lot of people don't talk a lot about those costs with, if you go into an appointment, but we're always upfront with them about that, because we always want them to know what they're paying if they just have Medicare. And then, of course, they need to know that they're still always going to pay that Part B cost. And of course, that did go up from the 185 to the 206.50. And then, of course, they need to know their deductible, because if they're going to go with a Medicare supplement, they're always responsible for that $288 deductible. So you need to be aware that made a change from 2025 to 2026. So this is important information for you to know for next year. Okay. Any questions about that?
Lisa,
and if you would like to have this chalkboard, I can email this to you. Just let me know.
Please.
Okay. I just email it out, and a lot of times we just take it and laminate it. It's just a nice thing for you to use.
Are the ACA premiums out yet?
No, they're not. I was hoping the window shopping might start this week, but it's looking more like it may even be the very last of October before those ACA premiums will come out. When Robin gets on, I'm going to see if she has any insider intel
I'm
about when those
on.
might come out.
Okay.
Is that
I'm
you, Robin?
on. Yeah, I couldn't like actually go into the Zoom, so I just dialed in.
So for those
Can
of
you
you
hear me?
who are
Yes,
not
we can.
aware of who Robin is, Robin Brooks is our contact with Blue Cross Blue Shield. I think most of you have probably met Robin, but if you have not, then hopefully you will get to soon enough. But Robin is amazing. And I think we have told you along the way that we don't ever want you to contact customer service with Blue Cross. So your contacts for any kind of Blue Cross questions or anything like that are going to be, you can call me, you can call Erica, you can call Heather, or you can call Robin Brooks. And so Robin is going to know just about any question that you've got with Blue Cross, and that's who is joining us today. And so we have her phone number if you ever need to speak with Robin, and she is always available to you. Robin is amazing. She never minds if you call her. So we're glad that she's joining us today, and you can all ask her any questions that you need about Blue Cross.
You're too kind. I did hear the question about the ACA rates, and unfortunately, I don't even have them yet. And it's all waiting for essentially everything to be finalized. Hopefully, the government shutdown situation, it's going to be to the wire. Unfortunately, we spoke with one of our senators, and they suspect that the shutdown may be kind of be over potentially the end of this week, but not super hopeful. I don't even have them yet. I can't even see them yet.
That's kind of what I've been hearing too, Robin. So I thought it might be Halloween before we get those rates.
Robin, what is your
Yeah, it's going to
phone
be
number?
pretty close. I'm sorry.
What is your phone number?
It's 205
Mm-hmm.
917
Yes.
9548.
Thank you.
You're welcome.
So anybody else have any other questions you want to ask?
Lisa, I wanted you to go over again because I use Connecture. And I know
Okay.
there's been a really big push that we have that ink signature. And if you've been doing Blue Cross, we've had the paper app and we would fill it out and have people sign it. But can you talk just a little bit about if you use Connecture, how you go about, do you still have to do the paper app, or is there a way that you can get the signature through Connecture?
So what has happened is that we worked with Blue Cross in adding a signature box to the to the portal, of course, and they did that. But Connecture used to have a signature box as well. Like I think in 2023, maybe they had a signature box. And last year they took the box away for some reason. And so now on Connecture, you can go on there and fill out a whole application. And all that you have to do now is check a box that says, I am agreeing to sign up for this Blue Cross plan. So no longer do they actually have to sign anything in Connecture. Now, that is okay through CMS. And so we all think, well, I shouldn't have to do anything else. But what we want to do and what Robin would like for us to have is a ink signature. okay? Just in case anything comes up that, you know, you have to go back to, because what she would need from you, or what she would ask for from you if you ever have an issue, is she needs that ink signature. So what we ask for you to do is, if you're doing an application in Connecture, is still to go ahead and get that ink signature. So to go ahead and have that application there and have them sign it. And I know that feels kind of like double work, but it's just to cover yourself. So that's just what we're asking you to do. Robin, do you want to elaborate a little bit on that?
Well, just I don't need the original. It can be a scan copy. I don't need the scope of appointment. We get different complaints, or customers saying, I didn't sign up for that option, or I didn't give that address. And a lot of the times I'll need a copy. Like I said, you can scan it and fax it, email it. I don't need the original. So if you write one up, scan it, shred the other one. But I just have to have that if there's an issue, let's say we had an issue recently where the agent forgot to put a lot number on the address when they entered it. So the customer didn't get their mail. They ended up canceling for non-payment because they weren't getting their mail. And so our compliance department agreed to reinstate them when they figured out that there was a lot number missing. So the agent had to show a copy of the application that was filled out and send me a digital copy to show the lot numbers on there to prove that the customer was correct so that we could get it reinstated. But we've also had a complaint this year where someone said that they never enrolled in the plan. And having that copy of that physical application that they signed cleared that up instantaneously. So I know, like she said, it seems like a pain, but it's really to protect you guys and to also help the customer if there's ever an error made. Sorry, that was the other phone ringing.
So it's just good. It's just good business for you. It just really covers you. So that's just what we're asking for you to do for us. Okay. And hopefully what's going to happen is that eventually Connecture might add that signature box back. Okay. Or, the portal will get to where that it's beneficial for you to do the signature box there. And you can just move to doing the Blue Cross portal, and it will be where you can house those there. We'll move that forward eventually. So, okay.
Are you guys saying that our customers might try to pull a Kirby Smart on us?
Mike, maybe, yes. That is exactly what we're saying. That's right. That's right. So anybody else have another question? Well, I know that I was sent some questions by email about the payment program, about the payment plan. There were a lot of questions around the payment plan. And does a member have to do the payment plan? And a member does not have to do the payment plan. It is not something that is, it's just not something that they have to do. They can opt in for doing that. And it is not beneficial for a member to do the payment plan unless they have a drug that's around $600 plus. Okay. But what is going to happen is that payment plan is actually done through the carrier. The payment plan, you have to understand, is not done through their pharmacy. The payment plan is actually done through their carrier. So what's going to happen is that the member is going to go to their pharmacy, and their drug may be $600 plus, and they may realize, well, that's a lot. And their pharmacist is probably going to suggest that they do this payment plan. And so what they're going to do is they're going to go back. They're not going to take their medicine that day. Okay. And they're going to go back home and they're going to contact that carrier and they're going to set up a payment plan. And so with that, the pharmacist or the carrier then is going to set it up on 12-month payments. And then they're going to go back to their pharmacy the next day and pick up their medication. And at that point, they're going to start being billed. Now, if they go in January, okay, that amount will be billed over 12 months. But you have to remember, okay, if they go in February, it's going to be billed over 11 months. And I got asked that question, for us to explain that, because, the later in the year that they get, that's the only amount of months that they have to pay that off. Okay, so I mean, if they go later in the year, they only have so many more months to pay it off. So you just have to remember that. They're not going to break it up in 12 payments if they go in June. Okay. So just keep that in mind. But do understand that that payment plan is done through the carrier. It is not done through the pharmacy. So the pharmacy probably knows about the payment plan and understands to send that person back to their carrier, but they're not going to know all of the ins and outs of it, because the pharmacy is not collecting that money and they're not setting that member up on that payment plan. They just probably know that if that person has a very expensive bill, to suggest that they go talk to their carrier about the payment plan. So you're not going to find a whole lot of pharmacists that are going to understand, hey, I need to set myself up on payments to pay for this, because they're not going to be the ones that are doing it. Okay. But it does not help a member if they do not have a prescription that's not over, it's got to be at least $600 or more. So just know that. How about any other questions? Anybody got any other questions? Anything just about AEP? No, a lot of you are brand new to AEP.
Hey, Lisa, I have something on.
Yeah. Was that you, Josh?
I have servers. Can you hear me now?
We can. Well, I thought we could.
If you're
Now you're on mute.
all right, I'm gonna try one more time, Lisa. And if I freeze this time, I'll text you later. But
Okay.
so basically referrals for new agents. I know we talked about that months ago, but you really have to, when you're with these folks, you have to ask them, hey, I helped you today. If you could just, a lot of people don't realize that they have to make a decision now. And so ask for referrals 2 or 3 times. We got to make sure we do that. Okay. So just do that. And then also make sure while y'all are out there, I know this sounds kind of crazy, but try to eat right, because if not, it's going to come around January. You've been eating all this fast food on the road, and but I guess you'll have yourself, you can ride on a chronic plan if that happens, but just try to eat healthy while you're out there too. So.
Yeah, so I'll give you a couple of tips. We used to do crazy things when Josh and I were at Humana for our agents to stay healthy on the road. But here in the office, one of the things that one of the newer agents here, she's not an agent actually, she's but she has got us so we do not get chair butt. Is what she calls it. She has had us doing squats every hour. So for those of you who are in an office, you might want to try that. Just making yourself get up and doing a little something every hour, so that you don't find yourself at the end of December having gained about 10 or 12 pounds because you're just snacking all through the day. And you're eating just whatever you can at lunch. And that is funny that Josh says that, because that will happen. I promise. Especially if it's your first AEP, you'll just find yourself doing that before you know it. You're run down and unhealthy, and you've gained 10 pounds by December the 7th. So do just make sure that you take care of yourself. And like Josh said, asking for referrals, find your way of doing that. And if you'll find a way of doing that, an interesting way at the end of every appointment, it will make such a big difference. I used to just make it a joke. At the end of every appointment, I would always hand them about 3 cards and say, and I'm going to give you some homework. How long has it been since you've had homework? And they would always laugh, and I'd just give them 3 cards and say, it's going to be your homework that you've got to hand out these 3 cards. So just make sure you put that in your spiel, because if you will make it part of your spiel, it will just become automatic to you, and you'll find that those people will start coming back to you. And you just want to make sure that you're asking for referrals for sure. That makes a big difference.
And Lisa, something else, just remember, it's not too late for because you're new agents, you don't have a book of business as big as some agents have been here for years. So you still can grab cards, and when you're doing your downtime, going from appointment to appointment or whatever you're doing, go by the doctor's offices and the dentist offices and give out your card. Remind them, hey, it's AEP, I'm your agent, things like that. Even if you haven't been going in there, it's never too late.
You think that it's all over the TV and it's all over everywhere. So people by the end of AEP are sick of seeing it all. But you do want to remind those people, you want to remind your doctor's offices, and you want to remind your dentist offices that you've been working with, that it's time. It's time to send those people to you. And, they're the ones that hear the complaints. I'm not happy with my plan, or this is not working for me. And so those are the people that can send you those people during this time to make that change. So if you make them aware, this is the time that they can change, then this is when they'll be sending them to you. But you've got to just make them aware, this is that time. Don't let them forget that. But just remember, we've got Robin on the line with us. So if you've got any Blue Cross questions, this is a good time to start asking her those Blue Cross questions if you've got any. We always have Blue Cross questions about, can I do this? Can I do that? Blue Cross, you got to remember, does not have any underwriting. So that's always a big key this time of year. So Robin, can you remind us of how we can maybe write a supplement this time of year with no underwriting? I mean, it's just an easy go-to, isn't it?
It is. I mean, you can enroll in C Plus any time of year, but you have to have a qualifying event, which essentially is loss of coverage. Friendly reminder, loss of Medicaid is not a C Plus qualifying event. But let's say you have another supplement with another company and you're just not happy. Even if it's voluntary termination of that plan, loss of a supplement with another company is an any time of year qualifying event. You have 63 days from the date of loss to do that. And then, of course, let's say you have subsidy and you use your subsidy to go from Blue Advantage to a standalone drug plan. And that subsidy, of course, enrolling in the standalone drug plan is still a qualifying event for a PDP. Well, of course, that's going to disenroll you from the Blue Advantage plan. Loss of a Blue Advantage or any Medicare Advantage plan is a qualifying event any time of year with C+. So just a few things like that sometimes there's a roundabout way you can get to C+ without having to wait till open enrollment if you have a qualifying event, depending on what it is. We had somebody recently that really, really needed C+, but they were losing their Medicaid. So They use the loss of the Medicaid to pick up an Advantage plan, and then the next month they use their monthly LIS to pick up a standalone drug plan, which canceled their Blue Advantage and opened up a window for C+. So sometimes if you're ever not sure, feel free to call me, Lisa, Erica, Heather. I'm happy to clarify if they qualify or not. But C+ is one that you can get in without, and there's no underwriting. There's one health question we ask, and it's if you have ESRD. And unless you're under 65, it doesn't matter what you mark on that answer. We don't care. It's only an issue for C+ if you're under 65. And if you're coming off of any kind of group plan with us, ACA plan, any health insurance with Blue Cross Blue Shield of Alabama, and there's no break, then we don't care if you have the end-stage renal disease under 65. We'll write you kind of as like the loyalty situation, but there just can't be a break in coverage. It has to be Alabama Blue Cross.
To go into C+. Now, it will not start until January 1st, but there's no health questions. So that's a big plus right now for during AEP. Any other questions about AEP? Because we're about to just let you go into it until December the 7th. Now, we're always here. We want you to know that. Anybody here in our office is always here to help you. You can reach out to us at any time. Please know that. And we're available to help you. So just know that we're here. So don't feel like you're out there on your own. We can help you, and just give us a call. And I think most of you have my cell number. If you do not, it is 256-483-2615. And so just make sure that you put that in your phone and give me a call if you ever have any questions. I've always got my cell phone on me. I know that some of you all can call the office phone number, and you can get to me that way, but a lot of times it's a lot easier if you just call my cell phone. Okay. Well, we're going to end this call then. We're going to just let you go out Medicare wise for AEP. Of course, right now, Heather is going to take over with ACA questions. That starts at 9:30. So we're going to let her move on from here. But we appreciate you jumping on for the Medicare portion, and I wish you all luck during AEP. I hope you just blow it out, and I think you all will. You're all rock stars, so I know it's going to happen. I look forward to seeing what you've all done on December the 8th and how tired you are. But y'all have a great AEP. Thank you.
Thank you, Lisa.
Yeah.